All right, you may have seen some stories online or messages on social media claiming there's a wonder drug that stops COVID-19. It's called Ivermectin.
Now, it seems especially popular with people who are unvaccinated. Ivermectin is a prescription drug that originated for livestock to kill parasites on animals like cows, sheep, and horses. Now, some people are gambling on it instead of taking the vaccination shots, proven to be effective.
So, does it really work against COVID-19? That's the question. And let's find out more this morning from Dr. Peter Lurie. He is the president of the Center for Science in the Public Interest. So, Dr. Lurie, thank you for being here.
Good morning.
Good morning. So, is there any science that shows that this drug, ivermectin, can actually be effective against COVID-19 in humans?
Well, there's science, all right. It's just that it's not very convincing. You know, there's some test tube studies. There are a few randomized trials that have been done, but they're all, the ones that are positive in general have been poorly done. So in aggregate, the World Health Organization, the National Institutes of Health, really every reputable scientific authority has concluded that there's insufficient evidence to use the product clinically at this time.
So when you hear that group of physicians saying that there are studies that show that it is very effective against COVID, do you agree or disagree with them?
No, I just completely disagree with them. And in fact, some of the studies that they've pushed hardest as evidence that the product works have needed to be retracted for misleading data presentation, even outright fraud. So the evidence base for the claim for effectiveness is terribly weak. Far more important than putting your hopes in something without evidence of effectiveness is to put your hopes in things that do work, things like vaccines, social distancing, and masking. But this is offered as some kind of alternative to that, but there's just no evidence that it works.
Yeah, no evidence. And when you have people screaming from the rooftops, don't take it. The FDA hasn't approved it. There are so many red flags here as to why it is a health risk. So let's talk about those health risks for people who take that drug, right, in high doses or for COVID instead of to use it to treat parasitic worms. What is that about?
Well, you know, there are some approved uses in humans, like for a very important condition in West Africa called river blindness. But that's different than thinking it works for COVID. And so when people can't get it for humans, they've gone off to the veterinary store and managed to get veterinary versions of the drug, you know, pills big enough for horses, literally. And so there's a fair chance that you'll overdose if you take the veterinary version. And people have wound up calling poison control centers with bad neurological or gastrointestinal side effects. So this drug, in this veterinary version, is for horses. Let's leave it for them.
Yeah, and what's really scary is because there haven't been a lot of studies on this, that even the smallest dose of this particular prescription could be dangerous with drugs that you already take, like blood thinners.
Yes, there's always that, right? And that's why, drug interactions are a real problem. And that's why it's important not to take medicines that don't have a solid evidence base behind them. There's evidence for this product for horses, there's evidence in humans for lice and for certain worms, but there's not evidence sufficient to use it for COVID.
Okay, so then why are we talking about this, right? How did it get started? Right? The rumor started somewhere in the game of telephone that this was a low-cost, effective drug to fight COVID-19.
Well, there's been an appeal throughout this pandemic for things that are simple and that will cure things. We heard that from the president on hydroxychloroquine. We heard it from, the ex-president on bleach. And this is sort of the latest in that iteration of products. So if you're a person who turns down vaccination, it would be nice if there was a drug that would cure you. It just happens that this isn't it. And so there's been an adoption of this product, especially in the right wing, in conservative circles, by Senator Ron Johnson from Wisconsin in particular, who held hearings specifically on this drug. And he brought in a doctor who claimed that it was a miracle drug. And this doctor, Dr. Corey, is part of a larger group of physicians who have been touting this drug since early on. It's gotten a lot of credence in social media, in right-wing circles, and that's what's keeping it going.
Yeah.
So if they continue to study this particular drug, do you think that there even is a small possibility that it could be effective against COVID?
Well, they are continuing to study it, and that's great. That's what should happen. When you have a product without evidence of effectiveness, what you do is you study it, you don't use it, right? And so That's happening. There's a big study out of Britain, another one out of Duke in North Carolina as well, and hopefully those will come up with answers.
Yeah.
And I'll tell you this: if that study shows that it works, I'm willing to eat crow on that. That's
Right.
fine. Let's just find the data.
So what do you think it is about the psyche then of people? We only have a couple seconds left, that they're willing to take that but not willing to take a vaccine. That people are that's already been approved.
Well, it's all gotten tied up, unfortunately, in politics in this country. And we've seen divisions in vaccine using that fall sharply along political lines. And I'm afraid the same thing has happened here. That's the last thing we need. But this is a disease, that is a communal disease that we literally share with each other. And so sharing misinformation is not the way out of this pandemic.
Dr. Peter Lurie, president of the Center for Science in the Public Interest, thank you for your voice this morning and being here to explain this.
Thank you.
Appreciate it.